Okay, discussing it with us next, we've got independent nurse Neomi Bennett, also Dr. Robert Gutsche of Lancaster University's Sociology Department, and Dr. Bharat Pankhania. If you were watching before this bulletin, you'll have seen him talking at length to Alex Salmond. He's the Exeter University Senior Clinical Lecturer there. Good evening to all three of you. Thanks for coming on the programme. We heard Dr. Pankhania about the various organisations, entities and businesses that are now expecting people to prove their vaccination status. Do mandatory measures actually make a difference?
I don't think so. And in many cases, it can be a smokescreen and also a tool to drop your guard. So, for example, you may be fully immunized and I give you a piece of paper and say, look at me, I'm fully immunized, and I get entry into your nightclub. I may be on that day very infectious despite being fully immunized. And because you haven't taken the checks and the balances of am I infectious, am I not infectious, I could enter that place with that pass that I have that I'm fully immunized and infect a lot of people. So management is multi-sectorial. We've got to do multiple things to keep people infection free, and just relying on a piece of paper which says I'm fully immunized is not the full measure.
Neomi, what would be a better way to convince people to not only protect themselves but also protect others if they're in jobs that require being around vulnerable people?
Well, I think also last year, with my experience of working in that environment before the vaccine was around, we emphasised a lot on hand hygiene and infection control measures and being sensible, and also safe distancing. So I just feel that the whole force compulsory takes this to another level. It just takes away the choice, and I think that's deeply worrying.
Robert, the government in the UK, just to take one example, had done 2 large public consultations, 34,000 or so responses to one of them. So they say they've done the research and this is the way ahead. Is there a danger, though, that by making it mandatory, that it could just embolden people who don't want to take the vaccine, who are on the edge of deciding?
Yeah, I mean, if we look at this from a media perspective as well, we see so much mis and disinformation that's spread via social media, that's reported on in journalism by journalists, sometimes to debunk, sometimes in ways that might elevate that mis and disinformation and amplify it further. So I think what we're seeing is a lot of confusion and maybe even some moral panic and hysteria that's coming from a lot of these bubbles and communities that are sharing concerns about the fears of not being vaccinated or the fears of being vaccinated.
Dr. Pankhania, are the restrictions largely based on trying to prevent transmission, or just trying to get the numbers up to make sure more people are vaccinated as they circulate in society?
No, we want to get the numbers up, because if you get the numbers up, a number of positive benefits accrue. One, the person is protected from severe illness and dying. That's one. Second, they are most unlikely to end up in hospital. And then the third, an immunized person is infectious for a shorter period of time and is less likely to throw out large numbers of virus particles were they to get infected. Therefore, the benefits of a largely immunized population are to the person and to the community in equal measures.
Neomi, the frontline staff of the NHS from next April will have to be vaccinated, but although the government's announced that it's going to be mandatory from next April, I was just looking at what the government's own figures suggest is that 90% of staff have already had both doses. Why do you think they're being so forceful on the remaining 10%?
I've no idea, to be honest. I think it's deeply concerning because, you know, we're still vulnerable in our places of work. Like, you know, patients have visitors come in. You know, there's lots of people coming into the hospitals, and I think it's quite unfair to just target those healthcare workers, you know, enforcing it. And I think a lot of it, we're not really, you know, we're not anti-vaccine. You know, we can see the importance of having the vaccine. However, I think you're just going to a different level when it's compulsory. You know, some people are risking losing their jobs over this because they feel that they should have the choice. And also there's several people that have had the vaccine, and then also have the contract the virus. So I think there's still a lot of unanswered questions.
Robert, it must leave businesses somewhat confused as well, because they've got a duty of care to their customers, some of whom are going to be worried and anxious about the possibility of getting COVID, and others who won't care at all. And it's asking them almost to police a health issue.
Well, and it does ask the question of what expectations do we as patients, for instance, or patrons have walking into an environment. You know, sitting here, I'm wondering now how many of my child's teachers are vaccinated. I don't know that data has been released. I don't know how many of my coworkers are vaccinated or not. And certainly I don't know how many of my students are vaccinated or not. Universities in the UK don't really like sharing that information too much for lots of reasons, a lot of it economic. And so I think that it's going to create a scenario where these passports and these documents really have us looking one way or another at somebody, and the social ramifications of this, including the immense inequalities that could come from the treatment of each other because of these laws and whether people conform or not. I don't think we've even started to talk about that.
Dr. Pankhania, we saw some of the anger from UK care home workers about being told by politicians to get a vaccination. But there will be people who remember back to last spring and those fatality numbers in UK care homes who are going to be thinking, if I'm putting my relative in these care homes, I want people to be vaccinated. They're going to be worried and maybe find that behaviour selfish.
Yes, I was going to answer the question about immunizations in hospital settings, which you asked the nurse panelist. And I want to augment that, which is in sensitive places, such as vulnerable patients, severely clinically vulnerable, etc. We've got to ask that you are safe to manage them. And therefore, if you are operating in that area, you've got to be immunized. And actually, we do so. So when I am in charge of things, I make sure my staff are immunized against tuberculosis, hepatitis B, chickenpox, influenza. So it isn't something new. The way the coronavirus vaccines is promoted by the current government is as if it is something new. We have been mandating vaccines, but in a gentle, kinder way. And to add one more thing before I answer your question about the nursing homes bit is, I have been talking to a lot of healthcare workers who have been hesitant about vaccines, a lot of them from nursing homes. And I gave them of my time, effort, and energy, showing them how the vaccine works, what it does, what it doesn't do, how it will protect them. And in the end, most of them went on to get immunized. So we need to do our homework of inform, advise, educate as well, rather than just saying, do it or you lose your job. In answering your question about the nursing homes, yes, I expect care workers to be immunized because, unfortunately, this coronavirus can be infectious and could kill the elderly people without your knowing on the day you were infectious. Furthermore, one more point, and I'll then stop, is you must do the same for influenza as well. We are forgetting that influenza is equally infectious and a bit of a killer too.
OK, I just want to get a couple of last points from Robert and Naomi. Robert, first of all to you, do you think that by increasing the mandatory aspect of this, that it's going to lead to staff shortages in the health service?
Well, I think one of the things that was interesting that one of the people who was interviewed in the protest or in the rally said was that without these care workers on the front lines, the NHS is going to fall apart. And I think that's quite disingenuous. And to your point, directly to your point, I think that there are lots of other issues that are causing the NHS to fall apart. And part of it is the funding and the lack of funding, the defunding and the privatization of the NHS. So we have to be careful to not let COVID once again mask a lot of the social issues that are going on in society that have been a long time affecting people, causing deaths, causing long time ambulance waits. There are lots of issues that are underlying this that we can't just let COVID overtake.
And just quickly, Naomi, most people would rather listen to and I'm sure health staff will be the same, would rather listen to their doctors rather than politicians over what to do with their health and who they should trust. If you were the government, instead of mandatory COVID vaccinations, what would you do to convince people to get a jab? Just quickly.
Like I said, I think it's not so much about convincing people and being mandatory. I think it's more about giving people the choice and giving them all the information that they require and letting them have the choice. Because like I said, this isn't about anti-vaccine. This is about being forced into something that could be at the detriment of your job. Okay. Not everybody was comfortable even straight away. So,
definitely talk to your doctor, read what the WHO say. All three of you, thank you very much for joining us on RT.